If you don't recognize this person, this is not the video you were searching for. This is Florence Nightingale, the founder of modern nursing. She lived in the late 1800s, but many of her nursing philosophies are still appropriate and the basis for the professional identity we have today. Florence gave up a life of luxuries to become a nurse, against her family's wishes. Her thoughts of nursing involved making it a unique profession, separate yet joined to physicians, through the common goal of helping the sick and the injured. Her early efforts to give nursing a separate identity included creating the original nurse's uniform. This was initially an effort to make it obvious to patients and doctors who the nurse was. Though uniforms have changed and become more comfortable over the years, they are still an outward symbol to patients to identify who the nurse is. This is me in my graduation picture from nursing school in 1989. At that time, I felt like my nursing identity was the nursing cap. It not only said I was a nurse, but also where I went to school. Both of these things I was very proud of. As we have progressed to the world of everyone wearing scrubs, there is a lot of confusion to patients sometimes about who really is the nurse. The cap was a clear indicator, and though impractical today, I really do miss the feeling of knowing I could be identified as a nurse in some special way. To build a professional identity, we must first understand what it means to think, feel, and act like a nurse. The nurse brain. Educational programs focus not only on skills but on individual thinking are designed by nurses in every setting. The nurse heart. Feeling like a nurse is different for everyone. At the core, empathy and compassion are required to be a nurse. The nurse actions. All actions taken should be taken with the consideration for the best interests and needs of the patient. Nursing research and best practice should be the basis for all nursing actions and policies that guide those actions. The professional identity of the nurse combines the brain and the heart to create unique actions performed by the nurse in caring for the patient. Florence Nightingale was the first to describe nursing as an art and a science. In this quote, she is speaking about the art, but it is true also of the science of nursing, as research-based best practice pushes the progress forward to improve our practice at the bedside and in the community. In World War I and World War II, nursing was celebrated in art everywhere. Magazines, newspapers, paintings, toys, and more. Prior to this, nursing was an invisible profession, obvious only to those in need of care. The art of nursing doesn't require a scientific explanation, because it is the values, principles, compassion, empathy, competence, knowledge, and caring that the nurse applies in the service of others. The art of nursing combines emotional care with physical care. The science of nursing is based in critical thinking, evidence-based practice, and goal-directed strategies. Research supports changes in clinical practice guidelines to improve outcomes and avoid preventable complications. Balancing the art and the science is becoming increasingly more difficult, as nurses are required to do more and more over shorter periods of time. Focusing on increasing task lists, documentation requirements diminishes the time that the nurse can spend with her patient, providing comfort and education. When nurses can combine their technical skills and clinical expertise with compassion, caring, and sensitivity, the patient not only feels like they have received the best care, they have received the best care and the optimum outcomes. Nursing research shows that having BSN-prepared nurses improves patient outcomes, decreases the likelihood of hospital-based complications, and decreases mortality. These findings are consistent with the requirements for the highly sought-after magnet designation. It's hard to argue with research-proven facts, but the information on why the BSN nurse makes these improvements is vague at best. To me, the work required to obtain my BSN has shown me how to find the why in what I am doing at the bedside. As a top-notch technical nurse, I know what outcome I want to have, but I don't always know why I want it or how what I was doing would help achieve it. I have learned that neither the art or the science of nursing can function independently without the other if optimal outcomes are to be achieved and patients are going to be satisfied with the care they receive. A patient who has less than perfect outcomes will remember the caring and compassion that the nurse showed them and consider it a positive experience, even if they didn't physically get what they needed. But a patient who has optimum outcomes that did not receive warm, compassionate care, did not feel like they had good communication with their caregivers, and was left with questions not answered, will not remember that we made them better. They will remember what we didn't give them.